The European Union is fully committed to developing the universal healthcare system in the Philippines. Universal healthcare provides a safety net for families so that in case of illnesses, catastrophic illnesses also, they have a system that helps them to overcome that temporary difficulty. It also provides a financial support so people can avoid getting into debt traps, but they can, after the illness and they have recovered, they can contribute as normal citizens in the society. That support has been mainly in the form of budget support, which is funneled through the Treasury and through that to the Department of Health. And thereby, definition, it is fully compatible with the development goals of the Philippine government and the Department of Health. We have had excellent cooperation with the Department of Health through the decade. They have been very forthcoming and very understanding, and it has been a pleasure to work with them.
We appreciate the substantive support of the European Union to the Department of Health's mission to achieve universal health care. We look forward to strengthen our partnership with the EU in providing better health outcomes to all Filipinos, making them healthy and productive citizens as well.
With support from the Governor of Tarlac, the Dangerous Drug Board and the Department of Health, we developed treatment guidelines, trained staff and mandated the first voluntary medical methamphetamine treatment center in the Philippines.
We put up this center as an outpatient clinic for drug dependents and their families. It had got its certification from a DOH as an accredited a drug rehab facility. We had to execute a executive order, a resolution for the creation of this center. So when you do talk to them, why are they getting into drugs? Because they say this new form of drug, meth, would keep them up for long hours because they needed to work. But what kind of quality of life,
Nagjo-duty po ako kasi sa trabaho ko, panggabi. Nagna-night duty po ako. Tsaka pinakamalaking influensya po sa akin kaya napasama po ako sa droga, yung sa barkada. Nayaya po ako ng barkada tapos isang bagay na kumbaga nagagamit ko po sa pag nagna-night duty ako.
Ang substance use disorder o yung addiction is a chronic relapsing illness. Sakit siya na paulit-ulit, although treatable siya.
We've imported a model called the Matrix model from UCLA. It was developed in the 1980s for cocaine, but it's a very good model for working with individuals who use shabu.
It's a medical treatment. It views drug use as a chronic relapsing disorder. It extends medical privacy and data confidentiality to drug use patients as we do for diabetes.
I would advocate for EU and other internationals to continue to support this initiative. It is viable as a community-based option, and most important, it is run by medical professionals who are accredited and licensed by the Department of Health.
When DOH started to work with the Tarlac Recovery Clinic, we were helped by partners. So dito yung pumasok yung EU, dito pumasok yung WHO, try to help us kung paano ba dapat yung standards na nilalagay dyan. So we looked into standards ng infrastructure, di ba? Yung design. So dapat may design siyang ganun. Tapos meron siyang mga manual of operations na dapat inaayos siya na dapat consistent yung operations ng guidelines starting from admission, pre-screening, until they go into a process of interventions, outpatient, until they are brought out and discharged.
Kasi ano ba yung gagawin mo pagka tinatamaan ka ng ganong pakiramdam? O kaya pag kahit yung lately po, yung paggalit ka, di ba? Ano bang ginagawa ng tao paggalit? Siyempre, pag may kaaway. Alcohol, kadalasan, minsan nasasamahan na ng yun yung may magre-relapse. Ibig sabihin, may pagkakataon kahit tinigil mo na, baka biglang ibalik mo kasi yun na yung mga trigger. Pero dahil doon sa alam mo na yung mga technique, mapiprevent mo yun.
What is good about this, it doesn't involve just the drug user or the drug dependent, but the entire family. We've had graduates already, our first batch of graduates, and they became our ambassadors in the different municipalities and towns. And they've seen that the program works. So now, for the second batch, we've had more enrollees coming in.
Kaya meron po akong dalawang kasama sa opisina na hinikayat ko po silang pumunta rito. Habang hindi pa po sila nararanasan yung mga naranasan namin, iwasan na po nilang gumamit.
From what has happened sa Tarlac, may mga interested that went with trying to say, hey, if Tarlac can do this, I think we can do this also. So the Department of Health has sat down and agreed that there will be about 6 recovery clinics that are ongoing. So meron nang dun sa Ifugao, sa Pasay, sa Calapan, Mindoro, Cebu, sa Davao, at sa Compostela Valley.
No one wants that drugs is prevalent in their communities. It destroys the very moral fiber of the community. What we want to push here is a rehabilitation of compassion. No? That the program not only deals with it, that there's some compassionate and a medical way of approaching the problem. We should not condemn. To me, as a mother, every life counts. No? Every person should be given the chance to transform and lead a more productive life.
The European Union assisted the Northern Samar provincial government in setting up its service delivery network in 2018.
In North Samar, we developed materials for local government and communities on how to access benefits of PhilHealth through service delivery networks. We focused on hard-to-reach areas and local government hospitals to improve quality and responsiveness of health services for the poor, especially women and children. Our analysis of regulatory policies, clinical practices, and patient flow dynamics will ultimately enable hospitals to serve patients better. We also enhanced the capacity of the Department of Health to regulate areas as diverse as health technology assessment, health impact assessment, and regulatory impact assessments.
May kababayan, mga Nortehanon, na magkaroon ng smooth delivery of health services. At least it will complement our own program of seeing to it na mga Nortehanon, especially yung mga nakatira sa sinasabing GIDA or geographically isolated areas, hard to reach area, na kung saan nahihirapan yung mga kababayan namin doon na nakatira doon to come to the health facilities like our provincial hospital, especially yung mga island towns. Well, not only island towns, mga barangay na inaccessible pa by road. So
we have the core group in the province, and we have identified 3 top challenges which I believe SDN can address or can help us address these challenges. And these are high maternal death, malnutrition in some municipalities, and the inadequate or lack of medicines, drugs, and supplies in our hospitals. Because we have partners like DOH and the EU that has helped us in trying to establish our SDN in the province. So with that, we have already conducted 3 workshops, and We will be, I think, conducting another one comes August. And with these workshops, we were able to invite our stakeholders from the municipal level as well as at the barangay itself, sa community mismo. Yung
pasyente po natin agad ma-identify, agad mabibigyan ng referral, and maiiwasan yung mga unnecessary expenses.
Marami kaming geographically isolated barangays. So kung mabigyan ito ng magandang serbisyo, ma-address yung needs ng community, ma-strengthen yung primary health care, we're hoping na maganda yung health outcomes sa Northern Samar.
The European Union assisted the DOH in making family medicine an attractive postgraduate career option for medical students in the Philippines. Centers of excellence at RHU level were set up as support for the family medicine strategy.
The contract has developed a family medicine strategy. This is designed to raise the profile of family medicine in the Philippines and to help the specialty develop standards which can be matched against international levels.
The Center of Excellence is one wherein there is delivery of quality healthcare. Then the infrastructure is able to provide for a very positive patient experience. There are systems and processes in place for continuing quality improvement. There is a system for coordinated and comprehensive patient care. Then, the RHU staff are trained or are oriented on how to provide an educational experience for students who would be placed there.
It was a learning experience. Una-una, there was an immersion, summer immersion, attended by the students of UNP. So nandun sila for 10 days and they came up with proposal as to how to improve the health situation in the different barangays of San Ildefonso.
With those identified problems, we were able to come up with 3 projects. First is the Uplan Osisero, Push Mo Yan Best, to address or to render trainings for lay people to do CPR. Next is Project Positive, to provide psychosocial counseling to teenagers to address teenage pregnancy in the community. And third is Project Success, to give toilet facility which is made up of indigenous materials.
We really need to advocate for medical schools to accept or to embrace the early placement of medical students in primary care. And there is really a need to look into the basic medical education curriculum and see on how it can be tweaked to make it more oriented to primary care and not to tertiary care.
Health human resources are an important building block of the health system. EU assistance focused on recruiting and sending health staff to local government health facilities. The medical residency rotation strategy was the approach carried out.
Medical Residency Strategy, or MRRS for short, introduces a system whereby medical residents training in postgraduate medicine in the DOH undertake a period of residency based in a provincial local government hospital and some DOH level 1 and 2 hospitals.
When they asked me what's the benefit of the other hospital, it's obvious that they would have more surgeries, they will have a resident, okay? They do not need to transfer this patient to us, especially if it can be managed there.
We do 2 to 3 operations per day So for the first month, I have done 45 cases. I can do more cases here because I'm the only one who does it. I don't have to compete with my co-residents.
Managing a case within the resources of the hospital is a challenge, and I want them to realize that. Because here sometimes with the presence of all the, the machines, the diagnostic procedures, they're so dependent on that. Like they cannot diagnose without an ultrasound, they cannot diagnose without a CT scan. So they're able to use more of a clinical diagnosis. It made them an independent thinker.
In the period up to the end of 2018, we will have achieved 12 regions, covered 12 regions, 16 teaching hospitals, and covered some 35 local government hospitals and DOH level 1, level 2 hospitals as part of the MRS programme.
MRRS aims to encourage more doctors to work in LGU hospitals and allow more patients to receive treatment closer to their homes. The European Union supports the Philippine government to ensure that quality health services are available where and when Filipinos need them, especially since more than 1/4 of the population fall below the poverty line. The EU helped improve strategies and systems to improve coverage of the uncovered poor.
Kasi yung BSW namin very active. Lahat ng BSW may hinawakan na puro. Hawak nila yung master list ng mga household. Meron doon, andoon yung mga name, andoon yung PhilHealth number. So alam nila kung sino yung PhilHealth member o sino ang hindi.
To strengthen fund management, EU assisted PhilHealth in updating methods, tools, and providing on-the-job trainings. Experts helped develop plans to improve PhilHealth rates for its different health packages. PhilHealth also developed a 5-year roadmap to move forward the policy reforms on provider payment.
Nag-uusap naman kami ng DSWD. Ginagawa naman nila yung dapat gawin. So yung listing na sinabit namin for replacement, ini-endorse naman nila to the regional level, so the provincial and regional level. Pero yung nakakawa, yung mga na dapat kasi i-validate yung listing na yan sa PhilHealth.
The project started almost before 4 years, and we have done a lot of technical assistance to both major organizations within DOH, which is the FDA. Component 4 is supporting 2 major divisions within DOH. One of them, the Philippine Food and Drug Administration in Alabang, and the other one, the Supply Chain Management System Division in DOH. Which is concerned about all logistics and supply chain issues within DOH, central and provincial level, of course, nationwide.
European Union support improved access to safe drugs for the population. The project helped revise systems for post-market surveillance of medicines, the pharmacovigilance system, and regular over-the-counter drug sales. The EU assisted in developing a national supply chain management system addressing the selection, procurement, storage, and distribution of drugs and good prescription practices. EU also helped DOH develop a manual for the logistics management information system from the national to the rural health unit level.
Most of this is already adopted, and the implementation process start, which can take between 6 months to maybe 2-3 years. In the FDA, maybe it will take you between 18 months to 36 months. But now, after building the capacity of the staff, they learned the protocol, the right protocol, how to do it efficiently but quickly. So the waiting time reduced from that month up to 3 to 4 months only.